Yeah, so I'll be talking about the Graftlink technique in ACL or PCL reconstruction, why and how. So I'm practicing in Pune for last 10 years now, and so I had first started doing Graftlink or All Insight after seeing Dr. Raghav Barve, a senior guy who actually taught me how to do it. So what is Graftlink? So it's a way of doing ACL reconstruction surgery in using a Graftlink, which is a technique in which you meticulously prepare the graft. So here a single bundle ligament reconstruction is done. So a single tendon, a semitendinosus graft is harvested in a routine manner. It is quadrupled and then it is affixed to two adjustable length graft loops, which can be sutured. So there's a very good way of doing it. I'll just tell you how to do it in my talk later on. But why to use a Graftlink is the first question, which is very important. Why Graftlink? Because Graftlink is a soft tissue preserving technique. Here you only require a single graft, which is a semitendinosus graft, and you don't have to harvest the gracilis or any other tendon. So since gracilis is preserved, gracilis acts like a secondary stabilizer of the knee. It also provides strength, hamstring strength, especially in footballers, and it also provides proprioception. So these are the advantages of preserving a gracilis muscle. And also in some cases where you have multi-ligament injuries and you require multi-ligamental procedures like an additional ALL reconstruction along with ACL or a posterolateral corner reconstruction or an MPF reconstruction. So gracilis can be preserved or can be utilized for such cases. So here in Graftlink, you utilize only a semitendinosus muscle, which can be sutured. So there are various literatures which support that Graftlink technique is better and than the routine technique. Since it is using only a semitendinosus graft, you quadruple the graft, so the graft diameter is very thick, so you get around 8 to 9 millimeters of graft in Indian patients. It has higher fixation strength, and you have excellent clinical outcomes, as been reported by Nawabi in his paper from SportsMed in 2014. Also, Graftlink is important because it is anatomical. You prepare femoral and tibial tunnels in anatomical manner. It is minimally invasive because you're using only a single hamstring graft, and using an all-inside technique, you're preserving the bone. So my colleague will later on point out how an all-inside is done. I'll restrict my talk to Graftlink preparation, and it gives you a reproducible result. You can actually tension the graft from both the sides. You can fine-tune the graft from the femoral and the tibial tunnel, so that you can get adequate tension in the graft, which is important. So there are various papers which support the Graftlink ACL is better. It has a better ultimate load compared, it can withhold a better load as compared to an interference screw. Up to 1000 newtons of load can be withheld with a Graftlink ACL. So how to do it is the graft choice is quadrupled semi-T. In patients who you get a very thin semi-T graft, you can also combine a gracilis. You can make an 8-strand Graftlink, or you can also use a quadriceps tendon graft to make a Graftlink ACL. So the minimum length required is around 27 centimeters of the tendon, and you then divide, you quadruple it, and you divide into 3 parts, roughly around 20 millimeters from the femoral tunnel, 20 to 25 for the intra-articular portion, and then 20 millimeters for the tibial tunnel. So that's how you actually do it. And the main construct for making Graftlink is the ACL tightrope RT. Here you see there's a flexible loop which has shortening sutures. Once you alternately tension the strands of this suture, you can actually shorten the loop of the graft. And there's also a fiber wire which is attached, which can be used for flipping the endo button, which goes outside the femur and the tibia. So how to prepare the graft? I'll just go through it. So you need a graft board. You need a good attachment so that you don't need any assistant for preparing the graft. You need these attachments. And so we'll go ahead and see some videos how to do it. So you need a single semitendinosus graft. You harvest the graft, you prepare it using your routine methods. The minimum length required is around 27 millimeters of the graft. And then you use 2 flexible loops using a tightrope. You fix this tightrope to the attachments and the graft board. Then what you do is you have to pass the graft over the tight ropes using a hemostat. You pass the graft through the loop of the tight rope, and through the other loop also you pass it. You pass it in a manner that you have a shorter limb and a longer limb. So you again take the longer limb and pass it across the loops of the tight rope again. So you actually make a quadruple graft with the two ends of the tendon coming out through the loops. Then you actually suture these two ends together, and by using a fiber wire number 2, and you take a mattress suture to secure these two ends of the graft. Then coming to how you go further from here is you then can actually give a little tension so that you get the length of the graft across. And here you can see the tight part of the graft is outside. So what you can do is you can actually invert it by reducing a bit of tension. You can invert the graft through both the ends so that the sutured end goes inside the loop and it is not impinging into the tunnel. Then you can take a 0 number fiber wire and stitch it in a routine manner. So you take a fiber wire, you go from in between the loop coming out, and then you go across all the 4 strands of the graft coming from below. And you repeat this step again. You again take the needle across all the 4 strands of the graft and come on the top. So you have to make sure that you're going through all the 4 strands, and then you make 3 or 4 loops across over the graft, and you see the index finger actually is securing the graft loop so that they don't open up, and then you can again come out to the center of the graft and tie the knot. So that's how it's coming out from the center. And then you secure this by tying a routine knot, maybe 3-4 knots. And then you cut the short end of the suture and then come out to the distal end with the needle so that the knot is getting buried. So this is how a graft link is being prepared. So I'll not go into much of details because a similar technique is done. You make another loop here and another stitch here also, so that finally your graft should look like this. So here we have also used a fiber tape for doing an internal bracing. So that's how you prepare your graft link for ACL. So you can either use 2 ACL tightrope RT, or you can also use ACL tightrope with ABS, and you can use an ABS button, so that if you have a patient in which you have narrow tunnels, you can actually do this and do it very easily to flip the button across it. So you don't have to flip the button, and you can secure it using a routine technique, and you can tie it over an ABS button. And for internal bracing, you can also use a fiber tape or a suture tape, which comes out, and you can then secure it over using a swivel lock. So that's how a graft link is prepared. Thank you.